often concerned with many of the disease. But do you know what is leukemia? Let us see. As medical science progresses, treatment for disease once thought untreatable have emerged. One disease that can now often be treated is leukemia. This is a cancer of the blood. It affects the body ability to fight infection, heal itself, and function normally. There are four major types of leukemia and several subtypes within each category. The main types are acute and chronic leukemia lymphotic and acute and chronic myeloid leukemia. As a rule, acute type progress quickly while the chronic disease progress more slowly. Chronic lymphocytic and acute myeloid are the most common kind, while acute lymphotic is the most common in children. In lymphocytic leukemia, the bone marrow produces too many lymphoblasts. A lymphoblast is an immature white blood cell formed from a lymphoid cell. In myeloid leukemia, too many immature white blood cells are present. These white blood cells are formed from myeloid stem cell, which also form red blood cell and platelets. Leukemia may caused by genetic defect or it may be result of exposure to high level of radiation or certain chemicals. It may also be caused by medication used to treat other type of cancer. Persons with Down syndrome are also at a higher risk for the disease. Regardless of the type of leukemia, a person may have the symptom are often similar. Symptoms may include fever or night sweat, frequent infection, a weak or tired feeling, headache, bleeding, and brushing easily. Pain in the bones or joint, abdominal swelling, or discomfort, swollen lip, nodes, and weight loss. None of these are diagnostic per se, but taken together, they often point to leukemia as a cause. Diagnosis is made through biopsy of bone marrow, which indicate the abnormal cell. Once the physician has a positive diagnosis of leukemia, he or she will often refer the patient to an oncologist who specialized in treating it. The specialist will probably consult with other doctors in the field about the patient and they will begin to assemble a treatment plan. Treatment will depend on the type of patient has. With early stage chronic lymphocytic leukemia, for example, a patient may not acquire immediate treatment but instead may be tested for sign of the disease progression. Although this type can rarely be cured, patient can achieve and maintain most symptom-free remission. Chemotherapy, radiation therapy, immunotherapy, and bone marrow transplant are the main weapon in the arsenal to treat leukemia. The immediate goal of treatment is to bring a patient into a symptom-free remission. The long-term goal is to keep the patient in remission. Patient may receive one or a combination of this treatment to achieve a cure. Many patients with acute condition can be cured, so immediate treatment should always be considered. Hospitals like St. Jude's Children's Research Hospital in Memphis, Tennessee have been at the forefront of research for treatment and cure of leukemia, and their research has saved an untold number of lives. With the advance in medical science in just past 15 years or so, this disease is no longer the death sentence it once was. Patients now have hope for cure. So if you have any symptoms which are same or chronic to leukemia, you can have a treatment for this. And don't be afraid that you are having leukemia and your life has ended. There is another chance for you. That's all for today. Have a great day ahead.